Hi, I'm Dr. Brett Boatsman. I'm going to talk a little bit now about a variety of the sedatives and injectable anesthetics that are used in horses that also have implications with people. And some of these medications are not only controlled by the Drug Enforcement Agency, and you therefore have to have a special license to be in possession of them, but they also have been used for a variety of things against people, such as date rape, self-injection with tranquilizers and near death, and putting people into a coma. One of the more common ones that are used by both veterinarians and lay people try to get their hands on as well is a drug called acepromazine. And acepromazine is used in both horses and in dogs and cats. Fortunately, acepromazine in moderate amounts does not cause too many problems. You can use it in a variety of ways, however, which makes it easy for people to use themselves. As an example, acepromazine will work if given or taken by mouth. So you can draw up a syringe of it and squirt it in your mouth, and it becomes sedated. And you can also do the same thing with dogs and cats as well as horses. One of the most common tranquilizers that exist on horse farms that veterinarians also use is a medication called xylazine. And xylazine can be injected both IV or into the muscle. And there have been two toxicology reports of xylazine causing death or near death in people. In one instance, a farmer injected himself with a very small dose and put himself into a coma. In another instance, a child inhaled some of this liquid and became in a coma as well. One of the primary problems with xylazine used in horses is if when given IV, which horse injections are generally given into the jugular vein, there's an artery on the inside of the jugular vein called the carotid artery. And if xylazine is injected into that artery, it will throw the horse into immediate seizures and potentially cause death. The next two drugs are controlled drugs, and these, specifically a controlled substance, means that the Drug Enforcement Agency oversees the distribution and production of these. The first medication is called butorphanol, and butorphanol is an opiate-based narcotic, and that can also be used for people to get high on, and it's a very potent sedative in horses, and particularly so when combined with some of our other drugs such as xylazine or acepromazine. Ketamine is the classic date rape drug, and ketamine is what we call an injectable anesthetic. It is also a controlled drug by the federal government. Ketamine, if given to a horse IV, will literally knock them off of their feet, and that's one of the things that we use to do some minor surgical procedures such as castration and fixing umbilical hernias and things like that. Ketamine is the #1 drug that veterinarians are robbed of, and in veterinary clinics, both small animal and large animal, it's common for them to be burglarized specifically for their supplies of ketamine, because ketamine is a very similar drug to PCP, and again, it can be, a small amount can be squirted into somebody's drink and can cause them to have loss of memory and be tranquilized and sedated such that they can't really fend for themselves. The point of all this is that these drugs do have many dangers for people, and if it's made legal for lay people to get their hands on these, it is very possible and made much more easy for them to have illicit use. I appreciate your time. Thank you.